So without further ado, I think we will crack on. I shall introduce the context, give you the strategic context for the review. So as a reminder, Research4Life as a program carries out a very in-depth evaluation of the initiative every 5 years. It's important for us to understand how the program is working for us as partners, but most importantly for our users, whether we're fulfilling the strategic objectives that we've set ourselves, whether we need to make any changes, and generally how the program is being received and how it can be improved. And the user review, the outcomes of that user review and the other aspects, the other components of the review, then form an evidence base when we set to produce, when we start producing our next strategic plan. The first parts of the review project were carried out previously, and they covered the infrastructure or the internal partner-related aspects of the programme. And we also commissioned a landscape analysis, which has since been published. And these two documents were formally presented to the General Partners meeting last year in July, and were formally adopted by the General Partners meeting last year. So this year we're moving on to the very in-depth user review, which was carried out on behalf of Research4Life by INASP, with whom many of you, I'm sure, are already very, very familiar. And I'm delighted that Siân Harris, who was one of the lead investigators on this project, is going to be giving this presentation this afternoon to present some of the key findings and the key recommendations that we'll be taking forward into our strategic planning process. So Siân will be coming back on the 22nd of June to present the user review to the General Partners meeting, and then we will ask for a vote, and we'll be asking the partners to adopt the user review and for it to then form part of that evidence base for the next strategic planning cycle. But because our General Partners meeting is a very busy meeting, and we really only have a very short space of time on the agenda to talk about the user review, we thought it would be a good idea to put on this webinar so that Siân can go through her results, her findings in a bit more depth and give you some opportunity to ask questions and to discuss the findings in a bit more detail, say as time will be limited on the 22nd. Without further ado, I shall now stop sharing my screen and I will hand over to Siân to present her findings from the user review. But don't forget, please use the chat function to record your questions. Thank you.
Hello, everybody. It's really great to be joining you today. I'm just going to be sharing my screen. This will unfortunately mean I can't see what you might be chatting to me. So I'm hoping that Andrea can interrupt if there's something that I need to know.
Yeah, I'll keep an eye on the chat, Siân.
Great, thank you very much. So I'm going to share my screen now. I have too many windows open. And so as Andrea said, this review is conducted every 5 years. And as you will be aware, we conducted this over the course of last year. And this last year or so has been a somewhat interesting time in the, interesting and not great time in terms of the global pandemic. So we had that also in our minds as we were doing this user review, and it presented some challenges, of course, in the methodology, but it also provided some interesting opportunities to see some of the different impacts of some of the things and to sort of stretch Research4Life's paces in a different way in terms of some users' experiences. So this is what we were looking for in the user review. We were looking at patterns and trends in usage, which is about relevance, the relevance of Research4Life. We were looking at the perceived value of training and outreach platforms and the content, which is about effectiveness. We were also looking at the impact of the various Research4Life programs on the scientific and workplace productivity of users, impact, And then we also were looking at some key learnings, some constraints affecting the wider use of Research4Life, and also some other interesting things that came out of the study. So that's what we were aiming to do. And how did we do it? Well, it was an extensive process which involved a lot of people. So we did in-depth interviews in 11 countries, Algeria, Bangladesh, El Salvador, Ghana, Mozambique, Myanmar, Nicaragua, Papua New Guinea, Rwanda, Ukraine, and Vietnam. And obviously, although I'm speaking in English, and I have to apologize, that is my native tongue. And I know there was some chat, so hopefully this recording will be available afterwards, and there will be a transcript, so it will be possible to translate into other languages. But the interviews we did, we conducted in 8 different languages. Not me personally, I didn't do them in these other languages. But it was really great to get more in-depth sense of people being able to talk more in their own languages. We did a survey of just under 2,000 people in 85 countries, and this survey was in English, French, and Spanish, and also did 2 in-depth case studies for 2 quite different countries. Obviously, countries on 2 different continents, countries that speak different languages, and also Kenya is a Group A Research4Life country, Honduras is a Group B country, which provided some other interesting insights. Following this, we actually then presented some recommendations and findings to Research4Life and had a workshop with different stakeholders involved in Research4Life to look at some of the recommendations and the findings and refine the priorities in terms of these recommendations. So before I share the findings themselves, I'd like to say a huge thank you to the big team of people around the world involved in setting up meetings, analysing data, translating the survey, and conducting interviews in focus groups in 8 different languages. And also to all the people who took the time to be interviewed, to participate in focus groups, and to complete the survey. And it's great that some of you are here joining this webinar today. So hello again and thank you. So on to the findings. So the first aspect, as I said, that we looked at was relevance, asking specifically the question, to what extent does Research4Life respond to the needs of its users? And the big thing to say, first of all, is that for people who use Research4Life or enable others to use it and had appropriate training and are aware of it, it's very relevant. The content, the feedback we were getting about the content is that it's high quality and trustworthy, and that users in general reported a good experience around access and use. However, there is a but. Awareness is low and usage has dropped. So first of all, just talking about the usage, this is a graph that was shared as part of one of the studies that Andrea mentioned last year. This is usage statistics of Research4Life over the last few years, and there isn't yet the availability of data for 2020. I think that will be interesting, probably not representative of any other year other than perhaps 2021. But as you can see from this graph, there has been quite a dramatic drop in usage, particularly of Hinari, over recent years, although in the last few years that has leveled out. So there's more in-depth insight into this that we got from the user review. We found that even in institutions where usage is high, this was often restricted to specific subject areas, to particular people or groups of people that knew about Research4Life and knew what to use it. So, for example, it might be one department, or it might be one site within a wider institution that knows about Research4Life, and the others that don't, which takes us on to the next point, which is about awareness. So the dominant factor in the low usage is awareness. So we found that over recent years, Research4Life, in response to various other user reviews in the past, has done a lot to address challenges in terms of the technology, in terms of the content, bringing in new programs, addressing issues around authentication. But the issue that has consistently emerged in user reviews and is still a clear issue is the issue of awareness, that on the ground, many people do not know about Research4Life. Indeed, we found this when we were actually doing this study, that often it was quite hard to find people who knew enough about Research4Life to want to be interviewed. Even the people sometimes who were listed as the institutional contacts were not very aware of Research4Life, or they were not having a deep enough understanding about it to want to talk about it. Another issue is around demand. So there were differences in usage depending on the type of institution. It's not surprising that usage was highest amongst people in universities, where there's a really clear link between the kind of information that's provided via Research4Life and the things that people are doing in their day-to-day life, where there was a need to be current in particular areas. And there's also another factor that emerged, particularly in the case study discussions, and this was the issue about statistics. Particularly librarians were saying to us that they encountered a challenge by not having usage statistics with which to influence behavior within their institutions, with which to understand where the places where the usage was strong within their institutions, where the usage was weak, whether they needed to lobby for more resources to make Research4Life more known within their institutions. So this was one of the things that came up, and I've got a few quotes that illustrate some of these things. So I don't know why it's got a rogue box there. I must apologize for that. So this is no, nobody told me about it. So a first step would be about promoting it. This was a comment from a country coordinator talking about processing new institutions joining Research4Life and the problem of finding that institutions are already registered, but somebody has not been aware because the knowledge about being involved in Research4Life has kept within one department or within one centre within an institution. And I have to apologise, it looks like that rogue box has appeared on all of my quote slides, so my apologies there. And this is a comment about the statistics too. So our next area of discussion was about effectiveness. Is Research4Life achieving its goals for the user? And you'll see from some impressive survey percentages that most people who use Research4Life rate this resource as effective, delivering the objectives it's intended to deliver. Most participants in our evaluation expressed satisfaction with Research4Life on a range of issues. These included the training, the content, and the ease of use. However, as we said before, so these are statistics for people who do use it. and they say it's very valuable. However, as previously mentioned, there are issues about awareness. So these are the kind of factors that influence effectiveness. And these are not necessarily factors that are, these are factors that influence where Research4Life is not very effective for individuals or institutions, but also where it is effective. So, for example, in the places where Research4Life was seen to be effective, there was good local support. Local support at an institutional level, or even at a sort of wider, maybe a network of institutions working together or nationally. This can be a librarian who's particularly excited about Research4Life, or it could be sometimes a senior researcher who encourages students to use the resources. There was also the issue about support from Research4Life. People talked about effectiveness in terms of having received training and having had their queries answered, or the converse as well. Language, as I mentioned at the beginning, as I apologize for talking in English, is a huge issue for some users in some countries. This is not just the language of the resources themselves, but also the language of the interface when you get further down into Research4Life beyond the homepage, and also the resources, the language of the resources like training resources. Another factor that influences effectiveness, we talked about scope of the content. So there were comments from some users about wanting more content that is relevant to their own countries or regions. And there was also talk about the issue of publisher exclusions. This is an issue I'm sure many of you are already aware of, the issue that in Group A countries, some publishers exclude some content from some countries. And this can change as well, so that the researchers become accustomed to having access to content, which then disappears, or they move from one country to another and they no longer have access to the content that they had previously. And there were also some issues around technology. As I said, there's been quite a lot of investment by Research4Life over recent years, but there were still some people who talked about problems with issues like authentication, challenges about searching, and also challenges that were outside the scope of Research4Life, but nonetheless were challenges for users in terms of their own internet access or other infrastructure challenges. And there was also an issue of confidence as well, how confident people are around using Research4Life. So again, I have some quotes. I won't go through and read out the quotes because lots of people told us lots of things, but I think these kind of illustrate some of the issues. So one of the things that came out particularly in these quotes was, and in things people said, is where Research4Life was effective, where institutions did things themselves and adapted them to the context of the institution. So this comment here was about organizing training within an institution organized by the library, and also about the integration of information literacy in the curriculum. So this is the challenge about English, but also it was interesting, as well as people talking about the challenges, often people talked about the solutions. So in this issue, it's identifying the challenge of English, so talking about English classes. Here was a different solution, presentation slides in English and then delivered in French. This was somebody talking in Rwanda, and helping to ensure that people speaking different languages could follow the training. And this is, of course, this is an issue about technology. So the third big question we were asking in this user review was around impact. What do users feel is the difference made by Research4Life? So I've got some nice statistics. These are statistics from the survey. And as I was saying earlier, the statistics and all of the comments through the that we heard from people who spoke to us were generally positive about Research4Life and about the impact. And it actually goes beyond just, you know, impressive numbers in a survey. We heard some interesting stories about the kind of impact that using Research4Life had. Here are a couple of quotes illustrating this, the importance of needing access to information in order to strengthen research for health, having access to former research, helping researchers to know how to make their own papers and also to have the material that they can reference. And this I thought was an interesting one. This is there were quite a lot of really diverse things that people told us, and this was an interesting example of somebody who is also an editorial assistant, and having access to Research4Life materials helped them to check the manuscripts that they were submitting and to check for duplicated work. So here are some factors that impact for good or bad. One of them is about how the content is seen. So as I said before, content is seen as and is trusted and seen as quality material. And this was something that really came through strongly from a lot of people. There's the issue of content being free. Now that is a benefit, but it's also in some cases a challenge. So I mentioned about the publisher exclusions and also about the costs for countries in Group B, particularly when countries have changed quite recently from Group A to Group B. So we heard from some Group B countries about some challenges in terms of the administration of payments, but also the ability to pay. So these were some of the issues that came up. Nonetheless, it was seen as a good thing, overwhelmingly good, that people were not encountering paywalls, you know, compared with some of the other resources that they use where they reach points where content is not available. Another factor about impact is an opportunity for capacity development. And that means that the provision of the research materials from via Research4Life enables people to develop different skills, to develop research skills, use of literature skills, but also skills in their research areas. So we heard about the opportunities of Research4Life materials being used in training of students and in other tools, other training aspects too. So beyond those three particular issues that we were looking at, there were some other things that came up. Oh, sorry, I apologize. Here I have quotes here, but so these are just some quotes about some of these challenges and the issues. So I'm now going to share just three of the other key learnings that came out of this user review. So one was about adaptation, also about open access and about local engagement. So adaptation, this is the question: how well has Research4Life been able to learn and adapt its approaches in light of changes in the broad operating context? Basically, this was a question of what changes have actually been made as a result of previous user reviews. And this was an interesting issue. There, as I've mentioned before, there have been significant technology changes. Previous reviews talked quite a lot about technology issues around authentication, around searching, and other technical issues. And it was interesting that while some people mentioned technology issues, this was not as prominent in this user review. It seems that the changes that have been made have made this less of a pressing concern to users. However, the big issue, one big issue that has come out throughout user reviews has been the issue of awareness. And raising awareness is not an easy task at all, but it's important to highlight that this is still an issue in this current user review. We reflected on some challenges, some reasons why this might be. Research4Life is not a single entity. It has people involved as part of other jobs all over the world. So it can be a challenge to have sort of unified approaches and the same priorities. So we're hoping that the recommendations from this review will help with this process. The next learning discussion that we had was around open access. It's really impossible to talk about any access initiative in this day and age without talking about open access. It was quite an interesting issue in this user review, though, because there wasn't kind of one unified perspective on this in terms of the users we spoke to. Some people see Research4Life as open access. Some people think that this is an important separate issue. There was some confusion and some lack of understanding, not so much lack of understanding as lack of a consistent idea about this, but there were some suggestions for Research4Life in terms of open access, and some of these things I know Research4Life is already looking into as part of a working group. So issues around communicating more clearly about what open access is, about helping publishers to make their policies around open access and open access waivers more clear and more transparent. And there were also questions about whether this is something that Research4Life could provide more of an administrative role within. The third key learning, which actually underpins really everything, I think, and is certainly the thing that really excites me, I think, is the issue about local agency. So this is the issue about community or lack of community. We put some questions into the survey about whether people feel that Research4Life is a community, and also how important community is. Because this is, it seems that a lot of times that when it's been successful because people feel a sense of ownership. They feel that they are invested in Research4Life, and it's not just a service that they get from their library or that their library gets from somewhere, but it's somewhere that they actually have a connection with. So we had quite a lot of discussions about this. This happens at different levels. I've mentioned before about librarians championing Research4Life within institutions, about teaching staff, but also about things that happen at a wider scale. So we heard some examples of library consortia providing training across several universities or a region of a country, and including within that training in using Research4Life. And these kind of things are interesting because they take Research4Life knowledge and expertise from just one person knowing about it, which then causes the challenge if a librarian leaves a university, for example, is there anybody left who knows about Research4Life, or does that institution end up in a situation where they find they have access, but they don't know they have access anymore, because the person who knows how to do it and who knew the password or who knew the system is no longer there. So having this sense of community that goes across from beyond just one person, having a kind of having training of trainers so that people are helping to spread what they're learning about the initiative is really important. Also, we heard of some good examples of the power of national level buy-in. So we heard about a country's Ministry of Health embracing Hinari as part of health strategy, and this meant that that it was more part of the workflows of the institutions, because this was also known about at a national level. So, as a result of this review, we came up with 7 broad themes for recommendations. And I'm just going to talk through these briefly now. And so the first one, so this is define how and why Research4Life's goal will be achieved. This is recommendation 1. So this in a sort of international development speak was and organizational speak was about developing a theory of change, having something that that defines what Research4Life wants to do and how it will do it, so that from that then springs the other things that define how Research4Life operates. So all of these recommendations, I should say, are kind of interwoven, and to some extent the other recommendations assume some level of taking on board recommendation 1. So the second recommendation is about building awareness, communication and community. And it seems to be important that these are all woven together, that the community aspect is part of communication and awareness, that it's not just an organization somewhere else saying something, but actually it's providing resources and having a unified communication strategy so that that local community ownership can happen, and that communication about Research4Life can be adapted, can be owned together and adapted to each individual context where Research4Life is used. And of course that includes having it having communication and other resources that are not in English. The third recommendation, this is about expanding and reconceptionalizing training. And just to unpack that a little bit, that ties in a lot with the previous one. It's about encouraging institutions to embed training in Research4Life and e-resources more generally within undergraduate curricula and postgraduate training. It's about encouraging more training and making sure that training is sustainable by having training of trainers, so that people aren't just going to a training course and saying, this is great, now I know how to use Research4Life, so now I will use it, but able to come away and say, I now know how to use Research4Life, and now I'm equipped to help other people within my institution to also know how to use Research4Life and to be able to show other people. And also looking at the other training material that is around. So not all the material used to train in Research4Life is produced by the core team. Things are being produced around the whole Research4Life network infrastructure of people. So finding out where people are producing training materials in a particular language and helping to support build and support the networks that enable other institutions that speak that same language to perhaps use and repurpose those materials, for example. And this actually then ties in with the next point. As I said, they're all linked together. So recommendation 4 is around improving support networks. So rather than everybody, rather than a sense that there are lots of individual institutions connecting with the Research4Life initiative, actually supporting the growth of networks within countries and between countries and within institutions as well, so that people are supporting each other in the use of Research4Life, and also tying in the use of Research4Life with other facilities around too. Ensure the platform and the technology supports effective usage. So this is ensuring that people can use the search process to find the right content more quickly, looking potentially for offline content options. This seemed to be an issue for users with difficulties with the internet access, either because of the infrastructure in their own institution, or because of issues with traveling away from their institution, perhaps being out doing field work, for example. And of course, this became a particular challenge for many users over the last year as they were working from home when their institutions were in lockdown. And the issue of authentication when people are remote, and particularly if somebody is, for example, a researcher in one country but studying in another, but researching in another country, and during lockdown they went home to their own country and were not able to access things via their internet, via their institutional login, because they were no longer in the same country. So there were many issues like this. There were also issues around gaps, addressing gaps and sudden changes in content. So this is around the publisher exclusions, around areas where people might want more content. There were some recommendations about exploring more locally relevant content, and also communicating clearly when changes are made. The final recommendation is about exploring new avenues for work. So this might mean introducing new programs, new subject areas, also around exploring doing more with open access. And so all of these recommendations, we presented them to a workshop of stakeholders from across Research4Life at the end of 2020. And after lots of discussion and unpacking these and looking at the implications, we then had a quick vote on these recommendations. So this was the order of the priorities. It could also reflect the order where we talked about them. So it may be that that also, because there was a progression in terms of the order they were defined, and also we were discussing them as an afternoon went on, so maybe people were getting more tired. But it seems that pretty much the first two recommendations were the most key. So having a shared vision for Research4Life that is clearly defined, that has defined objectives and impacts, and also having building the awareness, communication and community. And then following on from this, improving support networks, training, and then issues around technology. The only one that there was more debate about whether it should be a priority was around the exploring potential new avenues of work. And this was a recognition that there is still quite a lot that Research4Life would like to do in terms of the core offering of the initiative, in terms of addressing access needs, in terms of making people aware of the access available, and ensuring that people are trained so that they can use these things. And so perhaps there was a risk of spreading a bit thin in looking into open access or launching new programs or any other things. So this was a bit of a whistle-stop tour of a very large piece of research. Thank you for bearing with me with this, and I hope there is some time to answer some questions. I've seen every so often my thing flashing up saying there's things in the chat, so please do ask some questions. And also, if you are interested, you can also contact me for more information. Though I actually realize I haven't put my email address there. So contact Andrea.
Thanks very much, Siân, for going through. I know, as you say, it was a huge body of evidence that you produced, you and your colleagues, over the several months that you worked on this project. And I would like to thank Siân and her colleagues for a really excellent piece of work. It was a real pleasure working with INASP on this project. And I think they brought a particular level of insight to the questions that we really very much benefited from. So we were very pleased to have appointed INASP as our consultants. There are some questions, actually, I think they're more questions for Research4Life generally, rather than for Siân in particular, but I'll launch into them. Nilam, hello, thank you for your questions. What is Research4Life's goal? Well, at the moment, the Research4Life strategy or our objective is to reduce the knowledge gap between the countries of the industrialized north and the lower and middle income countries of the global south. That is the expressed objective that's set out in the current strategic plan that was obviously put together 5, 6, 7 years ago now. And I think one of the reasons why we feel that developing a theory of change is a good thing to do now is to discuss what outcomes we want to see in the future and how we're going to achieve those outcomes. And of course, it may be more than one. So, you know, we still want to reduce the knowledge gap, but there may be other outcomes that we want to see being facilitated through Research4Life. So at the moment, it's a fairly straightforward objective. Our goal is that reduction of the knowledge gap. But I think the world is a bit more complex these days, particularly as Siân points out around the issue of access to publishing opportunity as well as access to content. And we have a question for ourselves, which is what role should Research4Life play in that particular question and that change. The other question you asked, Nilam, was about what happens when researchers leave their institutions for organizations that have no access to Research4Life. Well, obviously, there are many resources out there. Research4Life also offers training in tools such as Google Scholar, Dimensions, many of the other resources that are available within our program. So if researchers have access to those tools when they move on to other places, they would have had some training in how to use them. But yes, we provide very specific training on how to use the Research4Life interface, but hopefully what we're also training in is information literacy, how to carry out resource discovery, how to navigate through the very large collections of content that we make available, and as do other platforms. So we recognize that there are other platforms, other resources out there, but hopefully a good grounding in how to use Research4Life will stand a researcher in very good stead as they continue with their academic career. Maria has added a comment, thank you, about statistics. Research4Life does provide statistics to institutions if requested. The provision of more granular, more regular usage statistics is very high on our shopping list for future technology projects. And I'm sure that's going to come back as we discuss the findings and the recommendations at our strategic retreat. Question there from Roxalana about whether the outcomes will be published. Certainly the full report that INASP produced and delivered to us earlier this year is available in full to all Research4Life partners. It's actually already available on the shared site that we're using for the General Partners meeting later this month. So anybody, any partner is entitled to access that document and to download it. We may do other kinds of promotion around the user review, social media promotions and blogs and so on, once it's been formally adopted by the General Partners meeting this month.
Just warn you, you need to set aside a bit of time if you're reading it. It's a long document.
Yeah.
There is about a 20-page summary, so that's
yes,
what I've based this discussion on here.
I think it's 145 pages in total, yes. With as you say, with the 20-page executive summary. But what the report also includes are the very interesting and very detailed case studies that Siân mentioned earlier from Kenya and from Honduras, which were very, very insightful, very useful. Also the script of the survey and the interview questions. So a lot of the background that went into producing such a very well-rounded piece of work.
Thank you, Andrea. One of the things that I think was quite interesting, actually, we shared the recommendations when we did the survey. We asked a question about whether people wanted to stay in touch and support whatever Research4Life does next with this. So this was outside the scope of our work, but following the initial workshop with Research4Life, we shared the recommendations with those survey participants, and we had some really interesting feedback, both echoing that the recommendations were in line with what they expected, but also they were also expressing a lot of willingness to be involved. And I think that's a really interesting opportunity for Research4Life that came through quite strongly in the user review, was that there's a lot of enthusiasm across the whole Research4Life community for being more involved.
Yes, thank you. And I see that the chair of our user advisory group, Professor Tandi Luoga, is online with us, and she's been terrifically helpful in energizing the user advisory group and sensitizing them to some of the findings of the report. So I think we have a very good buy-in from that user group to go forward with. And thank you, Edith, for posting the link to the Research4Life website, where in fact the user review is already available. As is, of course, as are the documents from the previous reviews. So anybody who hasn't yet caught up on the infrastructure review or on the landscape analysis can also find those documents on our website. So we have a few moments left if anybody has any further questions to ask. Well, who decides the content and exclusions list? Okay, well, that's the publishers, really. All publisher partners choose what content they want to make available and on what terms. And once a year, the Research4Life help desk sends out very long, well, not depending on the publisher, spreadsheets of all of the content that they make available, and they are asked to reconfirm what content they're making available and to whom. Obviously, many of the larger publishers are making their entire collections available, many thousands of journals, many thousands of books. You know, we're very grateful to all of those publishers who contribute their content. The exclusions is a challenge for us because, as Siân has implied, the exclusions can compromise the user experience if the user finds that they don't have access to a significant piece of content. But that's one of the arrangements with publishers, that they have other business interests and they are entitled to exclude countries. We're trying to simplify the way that exclusions work at the moment, but that's quite a complex process and we're working our way through it. The other ways of acquiring content is that users will ask us to ask a publisher, to request a publisher to add their content. I will reach out to publishers and invite them to join, and we've had quite a number of new publishers joining in the last few years, particularly as we move into new subject areas. We want to increase the amount of social science content we have, for example. So we've been identifying some of the top publishers and trying to pull in more content that way. We've also recently set up a collection development strategy committee. And we're actually looking at carrying out a gap analysis of the content in Research4Life, which is growing steadily. We now have over 30,000 journals available through the interface, through the collection. So we want to do a more systematic analysis of where we might have content gaps, particularly in non-English content, maybe in non-traditional content that is still of high value to our users. And that's an initiative that Mary Oakes and Susana Cardozo are leading. So watch this space for more information on that.
There was a question about who was involved in ranking the recommendations. I think that's also a question for you, Andrea, because you chose the participants. Yes,
so yes, thank you. The ranking of the recommendations was done, as Siân explained, at a workshop. And I mean, it was a kind of I wouldn't say rough and ready, but it wasn't a scientific exercise. It was more just trying to take the temperature of the room to see, you know, how were people responding to the recommendations. We had at that workshop about 25 participants representing all the different subcommittees, and the way that they came out in the ranking reflected the feelings of the people in that room. Or that virtual room anyway, but obviously all of these recommendations will now go into the next strategic retreat, which we're hoping to hold towards the end of this year, ideally as a physical event, but we shall see where we are at that point. And then we will carry out a more in-depth process to set our future strategy, to define our priorities and to agree some key actions.
I should mention that the ranking was a slightly rough and ready process in a way, because each, I mean, there is much more in the report that talks about this, but each recommendation actually has a lot of sub-recommendations, and people rightly pointed out there was a lot of linking between these things, but also within the sub-recommendations, people also identified, well, that one is a really high priority, that is less of a priority. And there wasn't time in this webinar to go through all of that discussion, but I would imagine that the ranking is only a rough guide rather than here is exactly what Research4Life must do and must not do.
Yes, for sure. Maria from our help desk, thank you, is letting everybody know that once the publishers have made their selections, once they've determined what offer they will make to which countries, all of our institutions are then made aware by the end of August, so that they can prepare whatever their plans are for training or for providing user guides, user materials for the following year, or indeed if some content is going to be withdrawn, whether they need to try and find a way of finding an alternative source to that content. A list of member institutions available online. The list of member institutions online is the universities only. That is the largest proportion of users that we have. That's so we also have other types of users. We create a complete listing of all of our institutions for the partners meeting once a year, but it is over 10,000 institutions. So we could probably pull out the list of member NGOs, but that's not a list that's on the website. On the website, you only find the universities. Member NGOs is a much, much smaller group. Okay. Siân?
Oh, I was only going to say that you know, the term institution that I was using throughout this presentation did refer not just to universities, but also all user groups. So yeah, as Andrea said, universities dominate, but we made sure that when we interviewed people that we had a balance in terms of countries, in terms of job roles, in terms of type of institution, and in terms of gender. And that was, it was, in some cases there were differences by these various characteristics, and in other cases, particularly actually gender, we were looking to see if there were any gender aspects to the findings, and we didn't find any significant gender aspects, but we did find some differences by institution type. For example, NGOs, government departments, etc., did in some cases have different user experiences, and also what we called broadly enablers, which is librarians, IT people, etc., the people who essentially enable the access to Research4Life versus the users, that's researchers, but also students, doctors, the people who are actually using the information. And there were some differences in user experience and also familiarity. As I said, there was a little bit too much for me to say everything.
Thank you very much, Siân. And I'm going to wrap up now by thanking Siân once again for coming to talk to us all this afternoon, and to the rest of the INASP team, again, for a fantastic piece of work. I think what has really been revealed is the complexity of the challenges that we're facing. And we have an amazing platform, an amazing network of partners who are helping to really make a difference to researchers and academics and teachers and medics and their lives across 125 countries, 10,000 institutions. There are bound to be huge differences in the way those interactions work and the way that individuals and institutions engage with Research4Life. But I think, you know, we can see that we're all supporting a hugely important and valuable initiative, and we have some big challenges and lots of interesting and exciting projects to get involved with in the coming few years. So I look forward to everybody's participation in the General Partners meeting later this month and your ongoing support for Research4Life as we embrace all of these new challenges ahead. Thank you all very much.
Thank you.